My name is Victoria Diaz, and we're going to record video number 4 for the science assessment class of chapter 19 and 20, examination of the neck, the heart, the vessels, and the peripheral vascular and lymphatic system. To begin with chapter 19, we're going to start assessing the pulse and the blood pressure of the patient, then we're going to assess the extremities, then we're going to go to the neck vessels, and then last we're going to assess the precording, which is the anterior chest part. Once we got the pulse and blood pressure done and the extremities are all assessed, we're going to concentrate on the neck. For purposes of this video, we're going to do this step first. The inspection, we're going to look for symmetry of the neck. We're going to look to see the symmetry across the tracheal line. We're going to ask the person to maintain the neck erect in a neutral position, just like she has it. We're going to stand in a 30-45 degree angle across from the patient. We're going to look for any bulging of the carotid or the jugular veins on the neck over here in this area. And we're going to look on each side one at a time. For the palpation stage, we're going to palpate each carotid artery bilaterally. By doing this, we're going to locate first the carotid artery, which is located between the sternocleidomastoid muscle, and then the trachea over here in the midline. We're going to feel for the amplitude and the contour of the pulse. By that, we're going to try, by that I mean we're going to look for to watch if there's any fluid present, any turbulence of the blood flow as we are assessing that. To assess the carotid pulse, we're going to ask the person to take a deep breath and then hold it, and as she holds the breath, we're going to palpate it really quick and then ask the person to release the air. The next step that follows is the auscultation part, and for this we're going to assess the flow of the blood that is normal. Again, the same, that no turbulence is present. We're going to use our stethoscopes for this stage over here, and then we're going to assess the turbulence of the neck. We're going to use the butt of the stethoscope, which is the smaller part. We are going to lightly apply the butt of the stethoscope to the carotid artery, and then we're going to do the same. We're going to ask the person to take a deep breath and hold it, then listen, and then exhale. There's a quick tip to determine and not get confused between the jugular vein and the carotid artery. The carotid artery does not change with the pulse, doesn't fluctuate with the inhalation or exhalation of air. The jugular vein does. So that's the reason why we ask the person to hold and take a deep breath and hold it. For the assessment of the precording, which is the anterior chest, we're going to inspect first for any bulging of the veins that are not protruding out of it, that's abnormal. We're going to, we can use what is called tangential light to just assess for any bulging of the veins. We can do the same for the neck, but if we have a good lighting source, it might not be necessary. So we're going to stand across from the person, and we're going to use the light just to see the bulging of the veins. For the palpation, we're going to look for the apical pulse. That's an important hallmark because it indicates the point of maximal impulse of the heart. It is palpable in most adults, and is located between the 4th and the 5th intercostal space, right underneath the breast area. For the percussion area, we're going to go around the precording. We're going to go around the heart. We're going to use as the same percussing technique. We're going to use one hand, and we're going to tap on the mid finger of the other hand that we're going to place on the patient's body part. In this case, we're going to go around the heart, and we're going to start at the second intercostal space, and we're going to work our way around the clock, just like this. You should feel any it's normal to feel dullness because of the cardiac mass that is located in this area. And if you feel any tympany, that's a normal sign. For the auscultation, that's the last step of the nursing assessment for this area. And we usually assess 4 main areas. That includes the aortic valve. It's located on the right second intercostal space. And the pulmonic valve is located on the left second intercostal space. The tricuspid valve is the 3rd area. It's located on the left lower sternal border. The mitral valve area is located on the fifth intercostal space, the left mid-clavicular line. For this, we're going to use the diaphragmal stethoscope, which is the bigger part of the hearing. Then we're going to assess in this motion. We're going to assess here first for the aortic valve. Then we're going to assess here for the pulmonic valve, then the tricuspid, then the mitral, and then the apical pulse over here. For the apical pulse, you should listen for a little longer. And all of them you should listen for about 1 minute. Always note the rate and the rhythm. The regular rhythm should be between 60 and 100. The heart has two sounds, which is S1 and S2, and those are the ones that you should look for. When you're auscultating, it might be possible you expect a little experience listening other extra sounds called S3 and S4. S3 comes before S1, and S4 comes after S2. They're abnormal, and they might proceed to what we call murmurs. The murmurs are abnormal sounds of the heart, and to assess for them, you should listen in both systole and diastole. You're going to listen at the apex of the heart, which is, as I said before, is where the apical pulse is located, or the PMI, and that's where you will listen to it more clearly. As a quotation part of it here, we're going to mention that the pregnant female always from 90 to 95% of the pregnant women have murmurs, and they dissipate as after delivery. An auscultation have exaggerated splitting of the S1 and S2, and that as well dissipates after delivery.